of them is called erector spinae muscle. Erector spinae. Here it is.
Spinal.
It is also present here. You can see it here. Yes, but here is more comfortable to look. So, erector spinae muscle, it fills the space between the posterior surface of the transverse processes and lateral surface of the spinous processes, and it's present on the whole length of our vertebral column, and it consists of three parts. The most lateral part is called iliocostalis muscle. Iliocostalis because it partially originates from the iliac crest and attached to the ribs. Iliocostalis consists of three main parts. There will be iliocostalis lumbalis, thoracic, and cervixis. So, lumbar part, thoracic part, and cervical part. Medially, there will be longissimus muscle. Longissimus muscle. It also consists of three parts: longissimus thoracis, longissimus cervicis, and longissimus capitis muscle.
Everywhere capitis.
Thoracic.
Lower
Longissimus capitis.
Yes, longissimus capitis,
Longissimus thoracic.
and between them
And longissimus cervicis.
Yeah. So. And the most medial part is taken by the spinalis muscle. Spinalis muscle.
Spinalis coli.
Yes, spinalis also can be divided into three parts: spinalis capitis, spinalis coli, and spinalis thoracis. Yeah, spinalis cervicis, which is thoracis, and in the upper part there should be spinalis
capitis.
spinalis capitis.
That's semispinalis capitis.
Not semispinalis capitis.
Capitis is for head.
Yes.
Spinalis capitis.
In ladder.
Yes.
And totally they combined in the rectus spinae muscle, and the rectus spinae muscle will help with maintaining our posture, yes, and maintaining our spine in erected position.
When there's a muscle pain, what exactly happens in there?
When it is muscle pain,
Spasm.
it can be caused by different different causes, because the muscle pain can be present, for example, if it is trained too much, for example, it can be caused by microtraumas and amount of the acid there, and some inflammatory process. It can be you can feel muscle pain, pain in the muscle if it is wounded, for example, or you can feel the pain if you have overstretched it. Yeah?
Maybe due to heavy contraction of lamens. Muscle lamens.
Also, it can be caused if there is some problems with nerves which nervate this muscle, like in patients with osteochondrosis, they can feel pain in different muscles because of the inappropriate signals from the nerves affected. Yeah? Like it sends the signal to muscle to contract, muscle contracts, and the reverse signal back, and this like pathologic chain of these signals which will cause the constant pain in some part of the muscles. So there are multiple reasons for muscle pain. Okay. Then deeper than erector spinae muscle we will have one more muscle which is called transversus spinalis muscle.
Okay.
Transversus spinalis muscle, which also present in 3 parts. You will find it in deeper section, I suppose. No. Yeah, here. Yeah, here.
Page number?
Next
Okay,
week.
got it.
So, this muscle, it consists of 3 main parts: semispinalis, rotator's muscles, and the multifidus muscles. Multifidus. Rotator's, semispinalis, and multifidus. What is common in these muscles? They are originating from the spinous processes and attaches to transverse processes of the lower vertebra. But the difference is in amount of vertebra which they pass. Yeah, for example, rotators, they're the shortest ones. Yeah, a bit longer ones are semispinalis, and the longest ones are multifidus muscles. Yeah. And
So
they
brevis is shorter ones.
rotators are shorter.
There are
What?
thoracic muscle and you have 2.